upon Dr. Shaban. He has joined us, and he's from Health Point Hospital from United Arab Emirates to deliver his talk entitled CPR Mock Drills and the Impact of Performance in Real CPR. Dr. Shaban?
Dr. Shaban? Yeah.
Assalamu alaikum. Can you hear me?
Yeah, doctor.
Assalamu alaikum. Hi, good evening, everyone, or good morning, everyone, and thank you for this beautiful conference. My name is Mohammad Shaban. I am the head of the clinical department, and head of the life support training center in Health Point Hospital, Abu Dhabi. So it is my pleasure to be with a selected pioneers in the cardiology like you, and I hope that my topic, it will be like getting in touch with your interesting. And to be honest, like my topic, I didn't prepare like a slide. I have few slides, but like it is more as an experience, because like I'm participating an experience, or like I can say it like a case study or research, because I'm doing this research and I'm contacting some journals like Cardiology Journal and like American Heart Association Journal as well for publishing this one. So like I'm inshallah in the stage soon. I hope inshallah it will be published, but I will share it with you, the finding that I started with my experience about the CPR mock drills and its impact on the real CPR like cases. So Bismillah. All of us, we know what the meaning of CPR. CPR, it is meaning the cardiopulmonary resuscitation. We know that every year more than 27 million cases they are died because of the cardiac diseases. More than 10 million cases they are died because of the sudden cardiac arrest, and this is that required from the healthcare providers in particular, and then from the general to having this kind of the training. So we have been trained them for three levels of the training. One of them they call the non-medical training, and we are providing this kind of the training for public people, and this one including the heart saver, something they call a heart saver, which it is like dealing with the patient who have arrested or unconscious who is arrested, and first aid. The second level, which it is basic life support, and this is they call a heart code, and we are dealing here with a medical professional people or healthcare providers, and we are providing this kind of the training for them. More specifically, we are talking about the three categories: adult, children, and infants. And the third level, which we are training them for the advanced cardiac life support, which it is like abbreviated with the ACLS courses. And we are giving this kind of courses for a selected team who is a CPR team, and we are giving it as well for the critical care physicians and the critical care nurses. So I'm an instructor with this one for about 11 and a half years. So like I'm with American Heart Association. I am also giving these courses in many countries. So like one of them I experienced whenever that I was going for a new hospital, which it is like what's just a new hospital, just like they created this hospital, and I was creating the training department, and I was shocked that the level of the resuscitation level there, it was miss. So I will show for you, I make like a mock drills, and I will show for you how this mock drills work. So like you can have a look for that, and like you will see how the people, they are like really lost, and they didn't perform anything good, either from nurses, either from doctors, either from the ICU team, either from the anesthetist team. So like I will play this one quick because it is quite long one. Okay, can you see this? Can you see my screen or no?
Share your screen?
Can you see the screen?
No, you have to share your screen. We are unable to see.
Wait a minute. I will see. I will share. Sorry, I need to share the screen. Yes, you're correct. So,
Yeah,
can you see
perfect.
it?
Yeah, perfect.
Okay, great. Okay, so like I will play fast, and tell me if you can also hear the audio. Can you hear?
Yes, we can hear.
This is a real patient. Real patient. This is a real patient. Please consider this as a real patient. Hello. Meet with him as a real patient. Do what? Pulse is not felt. Their pulse is not felt. Detected.
Okay, everybody here? Yep.
Okay, so this is the first one. As I told you, you can see right now one of the major things I can share it here, that everyone he's lost. He don't know what he's doing. Like they are not organized. The provider, they don't know what their rules. The team leader, who is the physician of the like GB physician, then the anesthesia physician, then the cardiology. He don't know his rules. Even if you see or recognized, well, they came just have a look, then they left. Then like they keep looking for each other. They are totally like a mess. And if you notice, the boss that they leave, it is even like it is exceeding for the like really horrible time, which it is like for 3 minutes. And all of us, we know in each minute that we are delaying the CPR, the patient is losing chances of survive between 7 to 15%. So like this is a quite like huge number thing we are saying about the resuscitation. So what I did here, I start implementing with them the learning style. Can you see the screen? Okay, so like it is here sharing. Hello, excuse me.
Yeah, no.
Yeah, can you see the screen?
Yeah,
Is
I
it-
can.
Okay, so this is the learning style, which it is visual, audio, reading, writing, and kinesthetic. So like immediately what I did, like I start with them with the I start with the 4 types of the peak, which it is physical readiness, emotional readiness, experiential readiness, and knowledge readiness. So like quite what I did, I start with them with a survey. I started with them with the interview. I started with them with the Kirkpatrick way. So if you will identify here that I analyzed the things, and I know that these people, they are depending on their old information. That means they don't have quite good enough resources. So what I supply for them, I supply for them the information via the online resources and by the workshops and the training. And I told them, guys, don't much believe the training that you will get it in the online, because like if you were receiving the online training only, that you will be lost here. So what you need to do, you need to go and like practice and more. So I keep with them. I'm giving them the intensive like trainings, and here the result where we are reaching for that stage. So you can see here, I can show for you here the levels that where we are. So all of this one is, I will skip it fast for you because this is details we don't need to talk about it. So this is the Kirkpatrick model of the evaluation. We're starting with them with the reaction. We see their level of the knowledge and how they will like getting the knowledge, what it is the most practice they are doing. They are learning, what it is the learning they get it or the benefit they get it from the training. I give it to them either by the virtual or the online, or either by the inside training like lectures or PowerPoints or ready PowerPoints or workshops. Then we're evaluating their behaviors that whenever that they went back to their units, how they are reacting and how they are performing. Then after that, the result, how this knowledge it is impacting the working style in this institute. So I will show for you the most question that I was having with them with the 5 questions. This is the like sample of the surveys. What is your opinion about the changing the life learning with the BLS? Which the option of BLS course it is most useful for you? What is the BLS online course impact on nursing performance? As I told you, it is like a blended learning. What is the barriers of the implementing CPR and BLS courses, and how you are improving the nurses' experience? So we can see here right now the result. I will get it to you. By the way, I follow the scientific approach with them. So that means it is a confidential survey. I use those documents from the American Heart Association. I got approval for that. And plus I created my own, which it is, I will show it for you later. So we sign, the participant, they sign that it is like totally confidential. It will not affecting or impacting or influencing their situation or their job security if they will say their opinion frankly and honestly. So they are comfortable and they are ready and they have like even willing to sharing or volunteer from their side. So we can see here like how they are experienced after they are receiving the life support training. First batch, we can see from the first batch how it is like increasing, and we can see in the fourth batch they are majority of them they give it like an excellent feedback. And what it is the performance for them, it is like they have more in the clinical and the critical thinking, and this is what it will be helping me a lot whenever that I evaluating their critical thinking and what their opinion. They are love the simulation scenario, and they love the differentiation between the age group and the critical thinking. And also one of the good thing that we didn't follow here something they call pass or fail. We follow something they call re-evaluation or retesting, or like give them another option or give them another chance. So if they are failed or give me a wrong or through the scenario or through the test, that means that they need to do it again. But there is no failure. I will keep behind them until they will be back. So here they are comfortable to participate. Now, they love the computer skills. They love that I give them anytime they are participating, but in only one case, that whenever that there is a mock drill, There are no timing choosing. All of us, we need to participate. So here, I will show for you the BLS online result. We can see here right now from the first one, because they are mixing with fear and their emotion. As I mentioned for you, this is one of the barriers they have. They are not limit, or they are not practicing very well. But on the fourth batch, which it is the experience, by the way, the experience, it is for 6 months. So for the fourth batch, we can see right now the result. It was among more than 80% of the people, they are performing very well. So here, even the retest option also, it is minimized. So we can see there is no retest option in the 6 month, the month number 6. They are no test option, which means they are well absorbed and getting the materials of the knowledge. So if we will see here the chances, so who is strongly agree, I will just highlight it for you. I would like to recommend the hard code as a program that it has helped me. As what we can see, 75% they are strongly agreed. And who is the least agreed or disagreed here? We can see the briefing of the simulation based in cases, improved my recitation abilities, only 3.3, they are disagreed. While if we are comparing to that, 53, which it is more than the half, they are agree for this experience. So, and this is, as I told you, the written test that I give it to them, plus the interview, and we can see here the pre-test passing percentage. If we are comparing to post-test passing percentage, and we can see right now how they are like. This is for different unit, because I didn't only choose for critical care. No, I choose also OBD, and I choose inpatient ward. I use also the ambulatory care, which they are like polyclinics or small clinics or mobile clinics outside of the hospital. I inviting them also to be participate, because all of us, we know the sudden cardiac arrest, it is unknown in any time it will be happening, and all of us, we must be ready. So we can see right now, for example, the percentage on the second batch from 33.3, it is jumping to 73.3 within only 6 months. And here also the we can see also here the numbers, and this is the mock drill, the which I take it for them whenever that I'm observing. And sorry. And one of the funniest thing here, that I give that the option also for employee to involve, who is involving and who is evaluating them. So usually me as head of education department and the head of the cardiology department and the CMO, we are 3 of us. So all 3 of us, we will be participating in that. And after that, we will sit together. We will like have analyzing the result. Then we will have again meeting with the participant. We will tell them what is going all right, what is going to be corrected, what it is the things we need to work on immediately. So this is like a sample, and this is the how the achievement of the score of them. So with the mock drill before the BLS, we can see only 6, it is jumping to 7.5, and calling for help 6.5 to 9. And one of the good thing here, the team dynamic, we can see 5 before the mock drill, and you can see here right now it is jumping to 9. We can see a wow. So I will show for you how it is jumping. You can see this video, and you can by yourself evaluating how they are really improved. There is one very arrest and fun. Yeah. So you know here, you can see here right now, everyone his role very well. Everyone he is participating strongly without like mixing their efforts, without mixing their rules. So and right now the anesthesia team it is calm. They came already, and they are ready for ICU team. Also they joined here, and the anesthesia team they are ready for the intubation. The GB team they are arrived as well. You can see right now anesthesia team immediately they know their role. They immediately went for the intubation, the patient. So you see right now, when I say for them ventricular fibrillation, all of them, they say shock. So they understand right now the algorithms. So you see, even right now, they are known well that how many shocks they need to give. Immediately they back to CPR and they know their rule very well. Again, shock. So as what I mentioned for you here, everyone, they know their rule very well. I'll just like advance it for you because all of them, they are doing a great job. This is the cardiologist team, how we are evaluating and how we are meeting with them and give them the feedback. Okay, now, so this is one of the things that we are love to talk about. It is how the people, they are reacting on the things. As I told for you, this is a quite long research, but I'm very limited with the timing. So this is majority of the thing that I did. For sure, there is in details and steps. If you are ready, I can provide it for you whenever that you are requested.
Thank you very much, Dr. Shaban. Very interesting, and it's good to know all of the different secrets to training residents and training a CPR team. Not an easy feat. I'd like to open the floor to any questions. If anyone in the audience would like to ask any questions about Dr. Shaban's training.
Just if you don't mind, I want to share also one of the things important.
Yes.
Which is right now when we are providing this training, like how we can see, like not only because of we are taping them on the videos or we are like making a research, but whenever that you are really working hard on something and you put this one as a target for you, the God, he will blessing you. So believe that for 1.5 years, 18 months, we don't have anyone died in our hospital because of the CPR. No one died. That means all of our CPR, successful CPR.
Yes, yes. That's a great statistic. And it goes to show that training is important, careful training.
Now, this is even like we have also one of our CEO, he was very impressed with that. And like he was giving this result to Al Khalij Times in United Arab Emirates, which it is a newsletter. And like, alhamdulillah, we are reaching for very proud result. God grace.
Oh, well, thank you very much for your presentation, Dr. Shaban. And I believe that, let's see, Dr. Banasode wasn't able to make it from India. So I think we will be closing the session for today. So thank you all for your attendance and your great presentation.